Hello everyone, I am Digambar Uffade. My paper title is Severity Detection of COVID-19 Patients Using Machine Learning Techniques and paper ID is 3926 and author of this paper are myself Digambar Uffade and my guide Dr. Aniket Mode. The contents of this presentation is first one is introduction, then methodology, then results and discussion. After that conclusion is there. Last one is references. Introduction. COVID-19 is name of the novel coronavirus disease. It is a disease caused by new coronavirus called Severity Acute Respiratory Syndrome Coronavirus 2 SARS-CoV-2. The most common symptoms of COVID-19 are fever, dry cough, fatigue, loss of taste or smell, nasal congestion, sore throat, headache, etc. So, according to the signs and symptoms to determine if a patient presenting in primary care or hospital outpatient setting as a COVID-19 disease. Introduction. We have tackled different machine learning methods to classify patients' dataset collected through online survey method. Our interest is to classify patients based on collected information. To perform classification based on machine learning algorithms, to find the better classification technique, comparative analysis is performed. Methodology. We have performed study through internet based survey method. This survey contains 33 inquiries or questions connected with the COVID-19 symptoms and diet. We have received 175 responses. Statistical visualization plots were used to easily understand the shape of the data. Chi-square and extra-t classifier methods used for the feature selection to identify which features are important. Methodology. Following classification techniques are used. First one is a logistic regression. We use the logistic regression when the dependent variable is binary like yes or no type. Number 2 is decision tree. In decision tree, it starts from the root node and it contains the parent nodes inside, and this decision tree ends with the leaf node. It is a tree-like structure. It makes a tree-like structure. That's why we are saying decision tree. Then we are using the random forest. So random forest contains the more decision trees, and this weak learner it contains the concept of assemble learning. From the weak learners we make a, by averaging the terms we make a strong learner. We use the artificial neural network, which it is a network connected with a group of nodes. It contains input layer, hidden layer and output layer. Use the support vector machine. Support vector machine is used to separate the data into different groups, and the line which separates the data is which is the hyperplane, and the extreme points from the hyperplane which is used to make find the best hyperplane are the support vectors. We use the k nearest neighbor classifier techniques, in which we are finding the similarities of the new data set with the available data set, and we categorize the new data which is most near to the available category data. We use the performance measure for this accuracy. By using accuracy we find the or how many observations are correctly classified. We use the precision, recall, and F1 score. F1 score is the harmonic mean of precision and recall. These are the results we obtain by using the chi-square method for the feature selection. We get these 5 features which are significant. First one is HRCT score. Number 2 is place used for isolation. Then NL ratio, dry curve, and oxygen level. So these are the 5 features we get the significant. Then we apply the classification techniques on these 6 select important features. First one is decision tree, random forest, uh, linear logistic regression, artificial neural network, support vector machine, and k nearest neighbor. Here we observe that random forest and logistic regression gives the more accuracy, precision, recall, and F1 score as compared to the other classification techniques. And then we use the extra tree classifier for the selection of the significant features. So here we get the 5 features which are the significant. Number 1, HRCT score, place used for isolation, NL ratio, oxygen level, and number of family members. Similarly, we apply these classification techniques and find the accuracy. So here we observe that artificial neural networks gives the 86% accuracy, more precision, recall, and F1 score as compared to the other classification techniques. So these are the conclusion. A fever is the major symptoms of COVID-19, and near about 12.58% respondent did not experience any symptoms. Data reveal that 75% respondent does not require hospitalization and 25% required hospitalization. Logistic regression model and random forest gives the high accuracy, that is 87%, with high precision, recall, and F1 score by chi-square techniques. It is seen that neural network gives the high accuracy, that is 86%, when constructed with extra tree classifier procedure with high precision, recall, and F1 score. These are the references we use, and thank you for giving me opportunity to present my paper. Once again, thank you to all.